Welcome to The Line. An article featured in the Santa Fe Reporter this month pointed out a disturbing trend that may add to New Mexico's healthcare provider shortage if it continues. In response to growing pressures from an overload of patients and paperwork, some physicians in New Mexico are scaling back their practices a bunch to focus on fewer patients for higher fees. Now, these more exclusive practices, called sometimes concierge care or direct primary care, provide more personal attention and quality doctor-to-patient time, but they also are geared to people who can afford upfront payments or retainer fees and not those who rely on insurance, Medicaid, or Medicare. Here to talk about this and other news of the week, I'm joined by former House Minority Whip Daniel Foley. Tom Garrity of the Garrity Group PR is here. Dee Dee Feldman, a former state senator, is with us. And Alicia Manzano, she's from Strategies 360s. Welcome to you all. Now, tell me, start with you. The article points out, and a couple other articles points out that, look, we've got a couple of things clouding over this idea, and one of them is that we have a fundamental, and Dee Dee, I want you to pick up on this as one of your big topics, a fundamental doctor shortage, an MD shortage here in New Mexico. The simple first question is, does this in fact exacerbate a problem, or can you not blame doctors for taking this route?
Well, I think there are two issues at play. One is that there aren't enough doctors. We only have 57% of all physicians registered in the state are actually practicing medicine.
That's a frightening number.
It really is. So, so you wonder what's happening to the other 40% or so.
Right.
The other issue is that, physicians just don't want to play by the rules that government wants to provide. And so, can you blame them for, wanting to, get rid of the paperwork, focus on just a small number of patients, and be compensated in their minds fairly for providing that kind of service. So it's kind of two separate issues, and I don't think one will create the other.
That's right.
Because even if people do have regular insurance, some folks will have a doctor that's available to them on the side that they can say, you know what, I have a little bit of a cough.
That's right.
Having trouble sleeping.
Right.
And just a doctor who knows them very well. And I think it's a good signal, too, to healthcare providers to say, how can we personalize care? And having one doctor with 2,200 patients might be a warning sign.
That's a good point there. And Alicia, what's interesting about the article, it's geared for not just individuals, but businesses as well can participate. But when you think about, as one of the article pointed out, one of the docs has 275 clients, down from 2,500. Tom mentioned the big number. They pay $1,350 each to this person, and the concern is that these are the worried well. They're not sick, they just want some peace of mind, and so it's okay to pay this kind of thing. But what does that leave off all the other patients who that doctor used to have?
Well, that's the major concern, right? With the Medicaid population in New Mexico so high, and so many people who don't have the advantage of having the resources to pay that kind of fee for service. We're going to have a shortfall of doctors for those folks, and those people are not going to get the care they need. And then I worry about then emergency rooms overfilling again, and then we can't get into primary care as it is.
Right.
So what will happen as this continues to shift, especially for those who cannot afford it? Now, I see the point for those who can, right?
Sure.
Some people who have great jobs and can make that kind of money and pay that fee, it takes them 2 months to get into primary care because there's not enough doctors. So they have that peace of mind to be able to get in whenever they need to. However, I'm just concerned about the greater population, right? It's probably 98% of the population that actually needs care that isn't going to get it through the concierge service.
All joking aside on your percentage there, that is part of the problem, Dee Dee. When you think about it, we're talking about a small subset of the population here in New Mexico where, $1,350 a year is really not that big of a deal just for peace of mind, and you can almost see something splitting in our culture.
Yes.
You know what I mean? A huge divide.
It's mirroring the divide between the rich and the poor. And that's not the way we want our healthcare system to go. I can understand completely the reasons why doctors feel that basically the delivery system is broken. And it's broken because of this fee-for-service system where doctors are rewarded for the number of patients they see, the number of pills they prescribe, the number of procedures they have, and that doesn't really address New Mexico's health problems, which are problems of chronic disease, of diabetes, of behavioral health, of asthma. And those kinds of problems could actually be handled by going in the opposite direction, by having more community health workers, by having paramedics do some of this home care. And if on the same chart that was in the report about the terrible shortage of primary care doctors, if you went down the list of nurses and dentists also in shortage, you look at paramedics, 9,000, 10,000 of them, as opposed to, a few hundred primary care doctors. We should be utilizing some of these mid-level practitioners to address some of the conditions that are overloading our medical system. And that would, I think, forestall the necessity of this divide.
Good point there. I appreciate that. Dan, when you think about it, I mean, again, for a lot of folks in this world, $1,350 a year is not a lot of money. But there are implications here, it seems to me, because something feels like a social contract of a sort is being torn here. Do you know what I mean? Like the medical business, the docs that I know that get into this, there's a tiny bit of sacrifice that goes into this. Not necessarily financially, but you're doing something for the public good. And it's not necessarily about just lining your bank account fully. Is this a dangerous precedent to you? Does something feel odd to you about this, or just
what I think
the free market at play here?
It's not even that it's just the free market. I think this is the manifestation of, the constant growth of Medicaid, the constant forcing doctors to say we're only going to pay you $50, $40, $30. I mean, we keep driving down the cost of what we're going to pay these individuals for their services in New Mexico. We drive it down because we continue to add to the amount of people that can get Medicaid in New Mexico, that we can put on this stuff. And I've said all along, the reason, when people equated me when I was in politics saying that I'm a bad guy for this, what I've said is you're seeing happen right now. You're creating this divide that the people who are not poor, they're going to keep jumping on the Medicaid bandwagon until Medicaid isn't good anymore. And then they're going to have an opportunity to get off. And you're going to have a bad product for the poorest people in the state. And so what we should be doing is we should be looking at fixing the system. The system isn't broke from the standpoint of, they're providing too many pills. That's a different conversation. The system is broke because what we've created is we keep pushing more and more people towards this single payer model that we keep saying doctors are going to make this. If you have this problem, you only get this much. We've created a system that encourages doctors not to spend time with you anymore. And so out of that system that we've created, and I think we, the politicians, have created that system, by the way, out of us creating that system, this now is rising, right? And what's interesting is when you talk about $1,350 a year, that's an interesting number because these boutique kind of concierge doctors isn't something that just started yesterday.
Good point.
5, 6, 7, 8 years ago, we had opportunities to sell services like this as an insurance deal. People were paying $10,000, $15,000 a year for just getting you on call.
That's right.
And then they would pay a fee to get you when you come in. So what I find interesting is that as the market keeps pushing us towards this model, the prices that the doctors are charging to go out and do this, and just in the articles, why are they doing it? They don't want to do the paperwork anymore. They're tired of spending, 3 hours to see patients and 5 hours to fill out paperwork. And that paperwork wasn't invented because someone likes killing trees. It's regulations, it's questions, it's problems that are created.
But it's insurance companies. It's the basic intermediary between the patient and the doctor, and that's the insurance companies. So I think to overlook that is a major problem.
Tom, there's another point there too. Another thing clouding over us is there's been reporting that our docs are aging out of the business in New Mexico. We have a lot of older doctors and MDs out there, and we're not necessarily replenishing the deal. Is there something about along the lines of what Dan was just saying a second ago to fill in that gap? People just sort of a fee for service. Is there a positive here for fee for service?
I think the positive is that it raises the game for everyone because some doctors might say, you know what, I can either move out of state or I can go ahead and stay in state and go ahead and go to literally private practice. What I think is interesting are the pure numbers of it all. With physician assistants, 746 registered or practicing in the state. That's a really low number.
It is.
Where we have 17,000 registered nurses, and all of this is coming from a survey by the University of New Mexico. And it's so the numbers show that what are we going to do to really change that status quo to get more not just RNs, because there's a lot of RNs,
Right.
but more physician assistants. How are we going to increase the number of doctors? And these are questions that we've been tackling for a long time.
And it's not just doctors too. I mean, you talk about this
Dentists.
state. If you need a pediatric neurologist, there isn't one and hasn't been one
Specialists are different,
for
yeah.
right, and those real important special things that at a time when you're especially, and it seems to be mostly with children, at a time when your child's going to need the most help, you take your kid to the hospital, they're going to ship them to Denver,
about
ship them to Dallas,
OBGYN?
ship them to Phoenix.
Well, there you
and
go.
say,
Yeah, exactly.
There are places in New Mexico where there are no
Northern New Mexico, they
OBGYNs.
have to drive all the way to Santa Fe from.
Yeah,
That's
to
right.
give birth.
Yeah.
That's right. This is a trend, Dan's right, you see this across the country, but I got to think for us here in New Mexico, this is a bit of a different situation with this trend. The ramifications are huge. We need to figure this out and maybe just attack the whole system. Now, when we come back to the line, we'll take a look at the Albuquerque mayoral election.